All right. Thanks everybody for the first Irish Coffee Hour of 2021. My name is Ryan Harbinson. I'm with Clearbridge Branding Agency. We're a full service marketing firm down here in South Jersey with offices in Philly and Chicago, and really can handle everything for your brand, basically from your email signature to billboards and everything in between. So branding, creative, target audience, marketing, and really our 25-point checklist. So TV, radio, video, SEO, social web, you got it. We can do it. So, and it's been really great to kind of see all the support for the Irish Coffee Hour, and I couldn't do that with some of our great sponsors. So we've got some great promotional sponsors out here that helped out and give them a couple seconds to introduce themselves. So Brian Barry with Catholic Partnership Schools. You're on mute, Brian. There you go.
Sorry about that. Good morning, everybody. Brian Barry with Catholic Partnership Schools. This is Madison. So if you're on social media with me, you know who this little animal is. I'm up in my attic hiding out. So Catholic Partnership Schools, we are a private management organization. We operate 5 independent Catholic schools in Camden, New Jersey. And we have about 1,000 students that we serve. But we all have a snow day today. So say hi, Matt.
All right, thanks, Brian. Brian and Mike are kind of co-hosts today as well too. So, and next is Mike Camiso with DocuTrend.
Thanks, Ryan. DocuTrend Imaging Solutions. We've been around since 2002. We focus on office automation technology, anything from copiers and printers. We're an authorized Canon, Kyocera, and KIP wide format multifunction printer dealership. Full service. We help customers realize inefficient, labor intense and paper intense workflows, and we try to help digitize those workflows and help customers save money, be more efficient, and free up employees' time.
Great. Thanks, guys. All right, so what we're going to do is kind of go around the room and let our roundtable speakers kind of introduce themselves so you get to know who they are. And today we're going to really be covering kind of like what's the current state of like senior living, senior care, and kind of the health elements altogether. So we will start with Kathleen.
Hi, everyone. I'm Kathleen McGee. I'm the Director of Care Coordination with the Rothkopf Law Group. We service Southern New Jersey and the suburbs of Philadelphia. As the Director of Care Coordination, my team helps our clients figure out the best care possible, navigate through the healthcare system, the long-term care continuum, and the attorneys figure out a way to pay for that care through public benefits, Medicaid, veterans planning, long-term care insurance. So it's much more care-driven approach to elder law than the traditional mindset of, spending down the money, applying for Medicaid in a nursing home. Thanks for including me.
Great, thanks for being here. Raf, you're next.
Hey everyone, Raphael Hachiski from Johnson Kendall Johnson. I'm a vice president there in the healthcare division, where we focus exclusively in the senior living world with our outsourced risk management model. We place the coverage as every other broker does, but then we also provide a plethora of services throughout the year. We currently work with about 250 senior living providers across the country on just various issues that typically delve outside of insurance as well. So looking forward to talking today. And Ryan, thanks for sending the Baileys yesterday.
You're welcome. All right, Sherry, you're next.
Well, good morning, all. I'm Sherry Alton. I am the Senior VP and Chief Operating Officer for Lutheran Social Ministries of New Jersey. And as such, I oversee the operations of our programs, which for us, just a little bit about Lutheran Social Ministries of New Jersey. Obviously, within the name, we are an organization that is based in New Jersey. We are nonprofit, faith-based, rooted in the Lutheran tradition. And our mission, which we adhere to rigorously, is to help all people in New Jersey who are in need or have limited choices. So we've been serving people in New Jersey for well over 115 years, starting back in 1904 when Lutheran pastors got together in Jersey City to care for the orphans. And we've grown so much in 115 years. And while our service line obviously is very different today, we do senior living, we do affordable housing for both families and for seniors. We have a food pantry, we have home and community-based services. throughout the state. And in addition to that, we also have immigration and legal services based in Trenton. So that's just a little bit about us, and you'll hear more, I guess, from me a little later on.
All right.
Thanks,
Thanks.
Ryan.
Yeah, and Sherry, if you could just lean a little closer to your mic, you were kind of
Oh, I'm sorry.
yeah, that's perfect.
That
Thank you.
better?
Yeah, that's
Oh,
perfect.
you're gonna make me sit ramrod straight here.
All right, thank you so much. You guys are doing a lot. And last but definitely not least, Caleb.
Hey, everybody. I don't know if I'm the only one, but I feel like anytime I end up on one of these virtual panels or I'm speaking for a decent period of time, my neck and back are killing me by the end of it. I don't know if it's because of the particular posture or just leaning in or whatever, but hopefully I'm not the only one. But Sherry, I can relate. So Caleb, I'm with Virtue Sense Technologies and the channel development manager there. What we are is we're an artificial intelligence company that exists to predict and prevent largely falls for older adults. So we work with long-term care organizations, senior living organizations, and health systems. We develop software programming that helps to predict falls, and then we use sensors to capture movement that basically feed into those software programs to create the information we need to predict those falls. So that probably makes no sense at all, but that's okay. That's what we do, and I'm happy to chat more about it anytime. Glad to be here, and Ryan, thank you for putting this together.
All right, man. Thanks. And if it's your first time here at Irish Coffee, we do not go around the room, but the chat box is wide open. So if you want to put your info in there, please do. And if you are looking for a copy of that chat box, I can send that to you. All right. So with that, let's kind of get started. So, I think it's been a crazy time, especially in this elder law senior care world, of just like all the precautions that are going on. And, I think one of the things that we've seen a lot is the people that are kind of like in the front line. So, Raf, give us a little bit of like insight. So, like, you work with a lot of the different facilities all over the country and stuff. Like, what is the morale that's going on in these facilities, and how's culture like staying like positive?
Yeah, good question. I try to tell people who are outside of the senior living world, and obviously Sherry being here, she can definitely highlight this and talk more about it way more in depth than I can. But I feel that these whole heroes work here signs and, all that stuff, Caleb, myself, Sherry, like we knew that the heroes were there well before the pandemic started. I believe that like once we get past all of this, the new like military applause that you see in the airports will be for those like nurses who, if they were to wear their garb into the airport, they would get standing ovations as well. People don't realize that a lot of these workers are not just working at the organization only. They have second jobs. They're struggling. They're not there to collect the paycheck. I mean, they're there because they like to serve their elders. They like to be able to provide the services that they can provide to these folks. Yes, they're going to get paid for it. Yes, the benefits are important, but that's really not why they're there. At least we hope not. I think right now where you're seeing a lot of burnout and you're seeing a lot of folks lose morale. And I think pandemic has kind of fast forwarded that decision for those who were on the fence as to whether or not they wanted to be, in this profession, in senior living. There are a lot of folks who, maybe now they've gotten spooked by the pandemic. Look at all the way to the top. I mean, CEOs in the nonprofit world for senior living, and Caleb and Sherry, I know you guys can tell me that you agree with this. You see a lot of white hair. You see a lot of old folk who are running the CEO, CFO roles. And all of a sudden, this pandemic is starting to kind of fast forward decisions on whether or not, maybe retirement now as opposed to 2 years from now is going to happen. I mean, things like that is a good thing, I think. It's a little bit catastrophic right now and cacophonous, but at the same time, pandemic has definitely kind of fast forwarded, I think, people's decisions as whether or not they're invested in this industry or not. But we're still in it, and we're going to be in it, and I think for a good part of 21. But I think the one positive aspect that we can pull out of this is that you talk to anybody in senior living right now who's offering vaccinations for their seniors, for their employees, they're literally having like parties in their organizations. They're having throwdowns while they're getting their shot, because they know that they're emerging out of this. We are going to come out of this, and there's going to be some positive aspects that come out of it. But I think we're also going to have to use this sort of as a teaching moment as we move forward into a new era now of what senior living is.
Yeah, I think it's definitely going to create kind of like a new plan that they're going to be able to have at all times. And like, what did we learn from this and how, I mean, because other than the tech side, I mean, we've gone in that first 3 months, we basically went 10 years in the future. And I think part of that has affected everybody in every industry. Kathleen, how about you? What's going on in the same side?
Yeah, I think that to your point, Raph, if I can call you that, Raph, the morale of the senior living community, they were so burnt out. They are still so burnt out. My experience, we have clients in the entire continuum. So we have long-term care, nursing home, assisted living, and they were there because they wanted to be there. They wanted to provide care. And I think the idea that they were losing so many residents really was sad for them, because it was like they were they're there to care, they're there to treat, they're there to make people better. And I think that the current pandemic has kind of wiped that from them. They were losing residents outside of their control, so it must have been such a letdown for themselves. And I applaud all of them for the amount of care and dedication that they've given the residents over the past 10 plus months.
Yeah. How about you, Sherry? I mean, you guys have kind of a handful of different programs that you guys are offering. What's it been like?
Sorry about that.
No, you're fine.
Yeah, it's better to keep me muted just in case the pets walk in, or some alarm goes off or something. So when I was thinking about speaking this morning, every time I thought about it, I realized that I could not even talk about the changes or what's different now in 2021 without going a little bit back to a little bit of a backstory. And for me and Lutheran Social Ministries, it goes back to the end of March 2020. And I just warn everyone who's on today that I will get a little emotional talking about this. I think it's really changed how we approach life, approach our work, approach our families, pretty much approach everything. And so backing up, and I actually looked up the date last night. It was March 28th, 2020. It was about 11 o'clock on a Saturday night. And normally I would probably be in bed, but I was on the phone, excuse me, with our CEO, Colleen Frankenfield, and we were just talking about our strategy. At that point in time, we knew that the virus was hitting New York City, while we had not been in our life plan community, which is in a suburb of New York City. We had not been really hit that hard yet, but we knew it was coming. And we had staff who were starting to call out. And in the prior week, she kept telling me, Sherry, like, I had offered to go. I'm a licensed nursing home administrator. My background from when I was in high school, I worked in dining services in a nursing home. I subsequently helped put myself through college being a certified nursing assistant. So she knew I knew the drill, and I kept volunteering to go up, and she kept saying, Sherry, you've got to stay put. You never know when we're really, really going to need you. And that Saturday night, she said, Sherry, you can go. So I knew things were like going to get really bad. And the part that I get emotional about is, so the next morning I gathered my family in the kitchen. What did we really know about COVID-19 at that point in time? Not that much, certainly not what we know today. And it was all very scary for everyone. And as I shared with my family that I was packing a bag, headed up to North Jersey to live for heaven knows how long, my college-age daughter, who was home on break, said to me, Mom, I'm going with you. I still get very teary about that someone who is that young and that, the unknown, that she just said, Mom, I'm going up to help. I don't know what I can do, but I'm going up to help. So from there, it really changed the work life, the workforce as we know it. We talk about the staff who, many of our staff have just been so resilient over the past almost year. But then we had other situations that we had to deal with. We had the situations where staff were afraid, where, basically they said, I'm afraid and I'm not coming back. And they ended in immediate resignations. We had the staff who were there through thick and thin, the staff who really and this is my favorite phrase out of all of this, is that we learned that on the front line, I don't care if you're the CEO, the VP of Human Resources, whether you work in marketing or you are the COO, you roll up your sleeves and you go and you do. And that's really the story of LSM&J. We did. We had to switch gears. We had to change how we do things. You know, anyone who works in senior living, long-term care, you know that for us, the use of the term agency is just not something we even want to have in our vocabulary. Did we have to do it? We did. And for those of you who have not been on the front line that way, and you say, Sherry, why is agency not a great word? It's because, you know, it's our integrity, it's our compassion. When we care for those people who have been entrusted to us, we want the best for them. We want to provide just the best services possible. We want to provide continuity of care. And so we want our own staff. When our own staff isn't possible, we look to how else we can do it. So I will tell you, and I'm not looking for a medal or something to pin it on, but I will tell you that I really had to dust off my nurse's aide credentials from 30 years ago or more. And I was feeding residents. Ryan put up a headshot of me, but had I thought about it, Ryan, I really should have put up the picture of me that shows me fully garbed. You would absolutely not recognize me. I had on the mask, the shield. In those days, oh my gosh, we were wearing shower caps to protect our heads. We were wearing coverings. Of course, I had on the gown. It was like, body armor. And, subsequently, we know things more today, and we know how to do that better and more comfortably. But those were trying times. But doing where we are now with staff. So, I just want to say Raf is totally correct about some of the white-haired, high-level folks have, some have really rolled up their sleeves. And, I've been in this senior living business for over 30 years. So even though I got my roots colored on Saturday because I knew I was doing the Zoom call today, I could be considered in that category. And so for people like me and our CEO, Colleen, we rolled up our sleeves. But to Raf's point, we saw that we had people like our chief clinical officer had not planned to retire for a few more years. She was excellent at what she did and such a great asset to our organization. But due to family pressure, she retired early. She was someone that prior to retirement, again, when things were bad outside of New York City and in New York City, she was the first one. She was doing the med cart. I mean, I don't have a license to do meds, but I joked with people that, at some point I thought it was going to come down to that, but it didn't. But we had our VP of clinical services on a cart 12 hours a day pushing meds.
It's great to see that too. Just like everybody kind of like, understanding like the culture has changed and everybody's roles are different now. And it's like all hands on deck. So.
Absolutely. And I don't want to take up the entire time, but I just one last thing just about workforce. So we've had to reinvent. And, when I was thinking about talking today, I actually wrote down just some words on a card because they really tell all of our story. So one of the things that we really needed to do was look at our strategy, look at opportunities. And so for some of the high level staff that decided to take early retirement or take medical leave, we looked at opportunities. And what we did in our organization was look to create some higher level positions that were more of a regional concept, because staff recruitment even at this point in time, it's just so difficult. And I'm sure all of you, even if you're not providing healthcare, that it's difficult to attract staff at this point in time. So we have been somewhat successful in that approach, but it's just taking the opportunities and sitting back and saying, what can we do differently? So for us, those are some of the things we've done.
That's great. Thanks for the insight. Really awesome. And I think part of that too is understanding like, what is like the, like how does all this kind of change the feel of kind of like of of senior living and nursing homes. And Caleb, I know you guys kind of really focus on this a lot. So can you kind of give us this kind of like insight, like, what's the like conception of like what senior living is now, and kind of like, you know, the difference between like nursing home and having like, oh, I'm just going to go put my grandmother or my grandfather in here and then that's it. So I know that's kind of changed now too.
Yeah. So I think if you're outside of the space of senior living, senior care, long-term care, I think most people kind of collapse or truncate it into two components, like 55 and older communities where, maybe you had a grandparent or you had a friend's grandparent, or, you knew somebody that was living in kind of a condominium type environment in a community that was set up for folks over 55, or nursing homes. And there's not a lot of understanding of what the landscape looks like between those two kind of extreme ends of the polar. So they're oftentimes collapsed into each other. It's one or the other. Senior living is a lot more complex than that. It's made up of a lot of different levels of care, a lot of different business structures, and like Sherry was mentioning, they're a part of a life plan community, which is sort of an insurance product and has really this emphasis, and I don't want to speak for Sherry or for Lutheran Social Services, but has an emphasis on, we're going to care for you across the continuum of your life. So wherever you come to us at, if you start in independent living and later on you need higher levels of care, we're going to take care of you kind of through that whole process. And we have the services here on campus on site to do that. I think, if I want to just pivot a little bit for a second to go back to what Sherry was talking about, because I think it's so important. Mm-hmm. The thing I've taken away from this last year is just how brutal of a year across the country it has been for senior care providers. It's not unique to any one state. It's really kind of the entire industry has faced was a cataclysmic event that affected them. It was a health crisis. And obviously a health crisis that primarily affected older adults. So that's challenge one, but it also created kind of a snowball effect of crises with staffing, with the financial circumstances and well-being of the communities that previously may have spent, X amount on PPE for their staff and for their campus. Now we're spending 10, 15, 20, 100X in order to get the supplies they needed to take care of folks. So, I think one of the things that I've shared with our team, and what became really clear last year as I talked to more folks across the country, and a lot of my partners, a lot of the people I'm really close to in the space, they went dark for months. And when they popped back up and we reconnected, it was really apparent at just how difficult this, the spikes and the season had been, depending on what part of the country they were and kind of what their experiences of outbreaks were. But they started sharing stories of their experiences similar to what Sherry was sharing, that are just, I think they're really important for us in sales focused roles and business development focused roles that are working with these partners. It's really important for us to hear, because I think that the biggest thing that's needed, and I think for our country, this is maybe going on a huge tangent, but one of the lost arts, one of the lost skills is that I see us really needing as a culture to invest in is empathy. We really need to do a better job of listening to each other's experiences, hearing it, allowing it to affect kind of how we view life, how we view each other, and how we approach circumstances, including business. And hearing the stories of these folks was just absolutely unbelievable. Stories of a nurse in California sharing with me that she worked 56 days straight, 16 hours a day. Just unbelievable burnout, unbelievable fatigue. They had points in the crisis where they were on the phone with the National Guard in a skilled building and saying, if you don't, like, tomorrow, you better come, because we don't have any staff. No one's here. And just to on a human level, to put yourself in their shoes, to put yourself in their experience, then it's sort of unimaginable. And I think too, one of the things that, for those of you who aren't terribly familiar with the space, this last year endured a lot of unfair criticism. And so this is part of kind of, to your question, Ryan, reshaping their narrative. What's the narrative around senior living? Well, at the height of the crisis, or what we thought was the height of the crisis last summer, you could see two narratives emerging with COVID. hospitals are heroes and long-term care organizations are the devil.
Mhm.
You know, you have hospitals that are, look at these hospitals, they're struggling, they're our heroes, they're amazing, we love our hospital workers. And here's another article about, you know, a skilled nursing site in New York who had 70 deaths. And look at how they mismanage it, you know. So there became kind of two separate narratives, and this was true, or this was happening before the crisis, but I think it was really accelerated by this last year. That folks that are in older adult care, especially in long-term care, face an undue burden and really scrutiny from not only the public, but also from the government. That there's very little meaningful collaboration that happens across many states, and certainly at a federal level, between like CMS, Center for Medicare and Medicaid, and the folks that are providing care in these homes. And so at the height of the crisis, you know, while these buildings are struggling to even get people to show up to work and to staff and to provide care, you know, CMS is slamming them with 15 different you have one agency, CMS, you have CDC, you have state agencies, all of them are providing different recommendations and guidelines and protocols on what they should do. And at points in the crisis, and some of this was well documented, they were conflicting guidances, right? There wasn't a unified voice from the government saying, hey, here's what you need to do, here's how we're going to support you, here's how we're going to make sure that you have the resources you need. No, it was, hey, on a government and federal level and a state level, we failed to prevent the virus from coming into the country. We failed to prevent it from spreading across our states. But somehow we think that it's reasonable to hold you accountable and to penalize you heavily if you fail to keep it from entering your community or spreading in your community. And so this is the sort of paradigm that I think folks in the space have endured, especially this last year, that's really important for someone who's wanting to work in the space and work with these partners to hear and to recognize. So the challenge now that exists for senior living, as I see it, and I say senior living, not necessarily skilled nursing, but kind of some of the lower levels of care, assisted living, independent living, and CCRC campuses, is that there's this narrative, there's this fear that senior living, because of some of these stories that emerged from the crisis, that it's not safe. And so one of the challenges the industry is facing, and you'll see this if you look at McKnight's is a really good resource. They put out a lot of information about senior living news and topics and things that are pertinent for the industry. Occupancy, or in other words, the number of folks that live in a community compared to the number of folks that could live in the community, is at an all-time. It's really struggling across the country. Many operators, most communities are really struggling to keep full. So they're having to combat and they're having to overcome this narrative that's out there now, and unfair as it might be, that senior living is no longer safe. And so you have these statistics emerging that, you know, 53% of baby boomers do not consider senior living safe. Mm. So there's, from a biz dev role, you know, when I think about for Virtue Sense and what we're offering, it's really important that we position our message in alignment with our customers' need. Similarly, these senior living communities have to do the same thing with their message of they have to figure out what is their value proposition after the pandemic. So what sold residents on moving into senior living before the pandemic, and what will convince them to move into senior living now and kind of after this crisis? And that's kind of what we're trying to help them build is the narrative that senior living is not just safe, it's safer than living at home. But it's a huge challenge. And I think, man, I don't want to share your story, made me cry. I don't want to go into some of the stories because I will get overly emotional and probably ruin this time. But it's been a tough year. And it's really important I think for those of us that are not necessarily on the front lines or working in the communities, but are working alongside the communities, to recognize that and be humble about it.
Yeah, it's great points, man. It really is crazy, man. Nobody really thinks about it. And I think we've seen it all the time, you know, heroes live here and all that. And I definitely want to go to Raf and Kathleen, because I know you guys are kind of in the front. So Kathleen, go ahead. We'll go with you first.
No, I can't agree with you more, Caleb. I think that a lot of blame was pointed to long-term care communities in the past 10 or so months. And even for the families, there was so much confusion for the families who had their loved ones there. They felt like they weren't getting the answers, but in the reality, the staff didn't have the answers to give them. This is such a new situation that everybody was going through, that they were in real time figuring out what they're going to do today. They had to kind of pivot their situation on a daily basis, and it was such a fluid situation that they were just trying to figure it out as they went along. And I don't think that they were given as much patience and understanding as they should have, because they really had to, like I said, in real time, figure out what they were going to do next.
Yeah, I mean, you see like one article on everybody at a hospital getting, lunch served to them, and then the next one you see Cuomo allows people to be in senior living, and more people have died in New York, and it's like every other state doing the same thing. So it's crazy to see that, and they had all these people already there. The hospitals were getting people coming in. It's kind of a weird situation that you're putting yourself in. And Raph, I know you deal with a lot of these facilities and multiple ones, so give us a bit of your insight as well.
Well, along with what Caleb was saying about just how punitive, I guess, the outside world has been to senior living pre-pandemic, during pandemic. I mean, look, in New Jersey, if you recall, at the very beginning, as the hospitals started to have influx of COVID patients, they basically dumped the remainder of the COVID patients on nursing homes.
It's crazy.
Right, we're into places where there wasn't infection yet. Meanwhile, in states like Connecticut, they created separate standalone hospitals to allow that. So, there's different stories being told in different states. And then, from a federal level, I mean, no one's brought up the fact that during the pandemic, as folks like Sherry are sleeping over in the communities, providing the services for the elder community to save their freaking lives, you have OSHA coming in and mandating that they're going to issue fines because you, Sherry, didn't properly teach the employee how to put on the N95 mask. So then you fast forward to like October, December this past year, and you guys can go look, and the Department of Labor happily issues their press release that says we've collected $2 million in fines, in OSHA fines, from senior living providers just because they're not teaching them how to put on masks properly. That's a great time to be doing this, don't you think? Kicking them while they're down. So, as we're all talking about, getting out the tissues and stuff, I'm going to kind of throw fuel in the fire and say, I'm getting pissed off because outside of the senior living world, folks don't realize the struggle that it takes. People call out from work in senior living doesn't mean just like, oh, he or she isn't going to come in. You as an organization have to fill that body role. You have to fill that role immediately. Like Sherry said, go out to the agency. Well, theyose agencies they're not in it for the organization. They're in it for themselves, for that individual. And so all of a sudden you have holes in the organization's service model where before, it was, ironclad. So I think there's a lot of issues that we're seeing right now where even to this day, regulatory bodies, government agencies, they're kicking these senior living providers while they're down. And, we're all business development people on this call. And that means that we're all very, very good storytellers. So let's leverage our ability to tell a story and really tap into the senior living providers with whom we're working or whom we know. And, to Caleb's and Sherry's point, tell the story. Tell what's going on with these folks, how hard it is. There's a CEO I know of right now who's on a ventilator, who lives right down the street from me, who I just found out is on a vent. That means she's probably not going to make it. And 6 months ago, I was talking about going golfing with her. This stuff isn't a joke. And so, I think, as bad as it is, people outside of senior living still don't realize just how bad it is for folks like Sherry as they continue to battle on the front lines.
It's craziness. I mean, I think part of that too is like, we have to realize that like it's affecting the families as well. And I know, Kathleen, I know you and your team, you guys kind of see everything like kind of through a tier process of everything. So like what happens there with your clients and the families that are being, involved in all this?
So to Caleb's point too, there's such a huge landscape between, staying home with minimal support up until nursing home placement. So you have such a continuum between that of independent living, assisted living, personal care, memory care, and clients. It's such a hard decision for families to make that decision of placement. I think there's a lot of sorrow, there's a lot of guilt that already comes with that decision when they realize staying home with minimal support isn't realistic or safe for mom or dad anymore.
Mm-hmm.
So to have that and then have this experience of not being able to see them, visit with them, be a part of their care on a daily basis was had such a negative impact on the family and the clients alike in our experience. When I think about my own family's decision. My dad is one of 7, and when the decision was made for assisted living placement for my dad's mom, he had so much guilt because he thought, among 7 kids, no one can support grandmom at home. But the reality is that everybody's working. We have young kids. We have jobs ourselves. So there is, again, a sense of sorrow and guilt. And I have had clients that to going back to March 2020, mom went into rehab for a hip replacement. It was supposed to be a short-term rehab, and she was supposed to come home, and she contracted COVID and passed away in a nursing home. And I think families, when they make this decision of we're going to look into long-term care, we're going to support the staff. It's not an adversarial, it doesn't have to be an adversarial relationship between the families and the staff of these communities. They're a part of the caregiving. The families are a part of the caregiving. They're there during meals to help feed their loved ones. And to not be able to physically visit and not being able to see your loved one, it had such a negative impact on the clients. And I think I think about it like the stages of grief. There was like this denial, and then they were angry and they were depressed, and I think they're coming around to accepting it, because I do think there's been such positive improvements. And again, to Caleb's point, I think now is a safe time to make that transition, because they're finally at a point that they can kind of, not that we're out of this by any means, but they've had the opportunity to kind of get through it and learn over the past 10 months. For the clients, especially for someone that has dementia, they can't understand why someone's not visiting them anymore. They don't understand why they're not seeing their husband and their wife who is there on a regular basis. So we've had so many clients that I say didn't die of COVID, but they died with COVID. It just had this such negative effect on them. They became withdrawn, isolated, they're not socializing, and it just had such a sad effect on the entire resident population across the continuum.
Yeah, sure. I'd love to hear from you as well. Like, what have you guys seen from the client and family side, since you guys are dealing with a lot of that as well?
Sure, thank you. Well, I will say that everything that Caleb, Kathleen, and Raf touched on is absolutely true. And I have a real life example for all of them, but I won't give all of those. But as far as, well, transparency was one of the words I wrote down that I wanted to talk about. So early on, we knew that, again, we are the kind of organization, we're not shoving anything under the rug. I'm trying to think of the negative press that we received. I mean, it really did a lot to our morale. And I don't even mean at the level of the frontline workers, because I think they were getting a lot of the, heroes work here. I mean, we did our share of banners and all of that. But at a higher level, it was just very hard to roll up your sleeves every single day. Some of us were working 16-hour days, even though we were working from home, because we were constantly having to combat both bad press, deal with the regulators, lawmakers, and then reach out to the families. So our transparency began with having portals on our website so that we could communicate with families and staff and residents. And we took the approach that we have to do this in multiple ways. And so we started with daily. Back in April, we had a daily letter that was customized to each community that talked about what was going on, gave family resources, staff resources, any links that we had to the CDC. We were constantly updating that. Again, the letters every day. And as you all know, things got a little better in the summertime, and we were no longer in an outbreak status. So we were able to back off from some of the communication, but we still always did at least a weekly update, even though we were not mandated to. With families, the way we did that, again, and this was not easy, but our CEO was right involved with writing the daily letters. She wanted to be very much involved, wanted the information to be accurate. Families, not only did we have the portal, not everyone is as easily can maneuver around the web. So we did those family members, we had email addresses for, and we sought them out. We did mass emails on a daily basis. And then I don't remember what year the telephone was invented, but just that old fashioned, pick up the phone and call mom, or in this case, call the
That's great.
daughters. Yeah, we did. I mean, we were working lots and lots of hours, and were there family members who were very appreciative, staff who were appreciative, residents who were appreciative? Absolutely. But what comes first to my mind is that it's kind of like that 80-20 rule that you always
Hmm.
hear about, like in human resources. And so we had the 80% who were either silent from complaints, or in the background saying, yes, you guys are doing a great job and this is wonderful, to the 20% who just I guess it was the stages of grief. And
Yeah.
so they went from well, we got mostly the angry the angry stage. But again, what we found was when we had the facts and we presented the facts, we did calm families down. And for the most part, some of those families truly turned around and, just said, thank you very much, and became some of our best advocates.
It's great. It's great to see that. And I think that's important, right? The transparency, I think, is one of the things that we've kind of learned, right? Like, people don't want to be left in the dark, especially when their loved ones are involved. So, I think we'll end it with this too. So let's kind of like, let's take all this sadness and try to turn it into something a little positive here, right? So, like, with everything that's happened over all these times, like, what are some of the things that you think that we've learned from all this stuff over the last kind of year or so? What was the ability to adapt to this, and what are some of kind of the major changes that we're going to see, you think, to kind of help that PR perspective come back around, right? That it's safe to be here, and really changes as a whole. So, Raf, why don't we start with you again?
Yeah, sure. So I think a couple things that have come out of this pandemic that actually, believe it or not, can be a little positive, and that's obviously we're seeing tech become a lot more of a prevalent thing in senior living, where before you said that to a senior living provider or an organization and they kind of were like, ooh, I'm a little afraid of tech.
And that's in the medical. I
Now,
think that's in medical as a whole, with like
yeah,
telemedicine now is like, I mean, it was kind of a thing, and like we were all like, yeah, I would love to just do a quick Zoom call with a doc, or like get my
yep.
test results. And now it's like, again, it's that we went 10 years in 3 months kind of a thing, and it's good to see those kind of that technology being integrated.
Where before, like, telehealth was more for the rural providers. Now, I mean,
Yeah.
any life plan community will utilize telehealth regardless of where that doctor's located, to eliminate the need for transportation, all that stuff. Think about us with our sales calls and stuff. We're going to try to make it so that we can have stuff like this, while at the same time balancing those in-person interactions that we, I think, all need to have as well. So, from a tech side, I think that's going to be a lot more important. I think digital marketing is going to be a huge thing. I think, as all of us get older, we all are folks who use Yelp and other, social media for reviews and things like that. That's going to become more important. I think you're going to see a fast forwarding of that, C-suite. I think you're going to see folks, come off faster than maybe didn't happen, pre-pandemic. You're going to have a focus. You're going to have a focus on people who are looking not anymore at the, pools and the spas and all these amenities that the life plan communities had pre-pandemic. Now it's going to be, is there an ability to have a place for social interaction that is safe? And so the focus of the client is going to be a little bit different. And so I think everyone will agree that if you can either adapt with the times, as we all did during this pandemic from our sales role, or are we going to just say, you know what, I'm going to keep doing what I'm doing, and then be left in the dust. So there's a lot of opportunity for growth if you do it right and you listen to the consumer, I think.
Yeah, and I think you're going to see kind of this evolution of the C-suite as well, where we're going to see kind of some new, C-suite positions that are being created as well, right? Like, is there going to be like a chief sanitary officer now, right? That's in charge of all that. And yeah, Kathleen, give us a little insight from your perspective.
No, I was going to agree with the tech side of things. I know telehealth has grown exponentially over the last few months. Not that we didn't have that before, but I know from my clients alone, referring to mental health providers for psychological support. Now that's covered by Medicare via Zoom or via just audio only, so they can use the phone. So just utilizing supports that might have been a little, not as available as they were before. But I don't know. I did hear of a community recently that was building kind of like a plexiglass visitation suite, so to speak. So if there is ever, you know, in the future with visitations, they'll be able to visit, loved ones will be able to visit in this kind of confined area. So I think communities are just getting more and more creative with adapting to how to still keep families and residents connected. To Raf's point, I think it is going to be much more client focused. And I think over the last 10 or so, nearly a year, the appreciation for the staff is so much greater because of everything they've been through. To Raf's earlier point, it's not just a job for a lot of these workers. It is they're there because they want to be there. They want to support them, and I think that we as a society and as families will be more respectful and understanding of their positions.
Yeah, I think you're really going to see kind of culture continue to be a huge part of it. And like, you know, just because you're seeing everybody more than they're seeing their families. So if the work environment itself is not a friendly and, you know, organized area to go to, it's just going to make everyone more stressed and a little bit more crazier. Sherry, go ahead. You're already good. Oh, you muted yourself. Hold on. Let's unmute you. You can unmute yourself. Go ahead.
Sorry, I seem to
All
have
right.
some lag time on that.
All good.
So-
Go ahead.
So for me, the word that really comes to my mind is it's the word opportunity, because, you know, we can't predict the future, but we need to be agility is opportunity/agility. We need to proceed as the way opens. So for Lutheran Social Ministry, what that meant was, to Raf's point about social media, we needed to adapt how we use social media. For us, two things come to the forefront of my mind. One was the vaccination effort was just an opportunity for us to showcase what we're doing. And background to those of you who don't realize how much work is involved in setting up a clinic. Months ago, we applied to and were able to partner with both CVS and Walgreens and different of our entities to provide the vaccination clinics on site. Can I just tell you, it was just a huge amount of work, and we were back to the 12 to 16-hour days just to get that all organized. Was it successful? Absolutely. I digress just a second, but my right arm hurts today because yesterday I got my second dose of Pfizer. So in a couple of weeks, I'll be good to go. And if I need to go back and provide hands-on care, I can. But anyway, so we use that as an opportunity for to show what we're doing, to showcase how safe it is in our communities. We did a huge campaign, and the heartwarming part about this story is that when our independent living residents at our life care community were vaccinated, like between 250 and 300 people, our executive director told us that there were residents who cried, tears of joy, because they were able to get the vaccine. They were able to get it on our campus. They didn't have to travel. They didn't have to wait in line.
Yep.
They didn't have to sit in the doctor's office. Just heartwarming. And then the other thing we're doing is showcasing our safe living, because others have mentioned this, that our communities are safe. I mean, just our infection prevention, the things that we are doing is just incredible. Ryan, I did want to just talk about C-suite for a second. And while we have not, infection preventionists, so that's something that the federal government has now mandated that long-term care facilities have in place. This was in the works prior to COVID, but you know, how timely could it be? And while we don't have that as a C-suite level of position, it may not be far from the future.
Love it. Thanks so much. All right, Caleb, take us home, my friend.
Two thoughts come to mind. One, in terms of what we learned from this crisis, or maybe a positive that has emerged from this crisis, and it's going to sound like a negative, but I don't mean for it to be. I think we gave a lot of lip service in the past to how we value older adults, and the process of aging and the reality of aging. I think culturally, aging is sort of an inconvenient truth that we like to kind of pushed to the side and don't think that it's going to happen to, especially those of us who are young. You know, it's sort of one of those things that we'll deal with in a long time from now. And hopefully we're engaging with our grandparents, and hopefully they're not alone and isolated, and hopefully they're not struggling with lots of health needs and things like that. But it's sort of this like thing that aging is, you know, this is going to sound very almost childish, but aging is yucky, and we don't want to deal with that. Aging that's hard stuff, and that's messy. And I think our policies and the ways that that sort of philosophical bent came out in the response this last year, and some of the ways that older adults were made to suffer because of our lack of prioritizing their well-being. So I hope that one of the things that emerges is that we don't just provide lip service for how we value older adults, but we actually value older adults and respect them. And there's a lot of assumptions that just when you get older, you lose these folks have led amazing lives in communities. The communities I go to, I meet former astronauts and physicists. I met a guy who cloned a cat. I met, you know, these are just incredible people. And it's easy to, as you age, and especially as you get much older, and especially as you start experiencing chronic conditions, your health declines, maybe even you suffer from a cognitive impairment. You know, it's easy to kind of miss out on just what an amazing life that these folks have led, and the things that they've suffered through and sacrificed over their years. So I really hope that we can more seriously value older adults coming out of this. The other element that I see a takeaway in kind of addition to the technology conversation is health systems and senior living communities are on the same trajectory in one particular vein. Care is moving to the home. So the brick and mortar, the care in the future, you know, you'll go to the hospital when you're very acutely sick and at risk of dying. But most care and procedures and things that can be done to provide you with health care that could be done at home will be done at home. And healthcare is moving quickly from instances of care, I feel sick, I need a doctor, to like predictive care. We have right now in America, I think we have what's probably more aptly characterized as sick care. Of you engage with the health system, your health provider, when you have a problem. I think healthcare in the future is going to be especially enabled by technologies, and there's going to be some questions about privacy and Big Brother and all sorts of other things that I'm sure will emerge as a part of this. But healthcare is moving to the home, and I'm seeing a lot of senior living communities move some of their strategic focus long term to CCRC without walls, or their home health divisions, or, you know, not everyone is going to move into an actual brick and mortar community. So some of these organizations are repositioning their value prop for the future of how do we meet the needs of tomorrow's seniors, and that's kind of I think that's certainly been accelerated, and I think these communities will find themselves more closely in alignment with health systems, health institutions than previously. So that is my thoughts. Thank you all for having me.
Love it. Yeah, great insight, everybody. Really, this is really amazing. I mean, it's good to see like what's happening, and good to see kind of what we've learned and how everything's going to adapt. So at 9:58, that is it. I want to say thanks to everybody. You know, our roundtable with Kathleen and Sherry and Caleb and Raph. Thank you guys so much for all your great insight. If anybody wants to touch base with anybody, please reach out. I have a copy of the chat I can send out to you if you want it. Any closing statements? Raph, you went off mute. Did you want to say something?
Oh, no, I was just want to say thank you again for having us as well. And, you know, all of us salespeople, I'm going to give you all some homework. If you so desire, reach out to a local senior living community. Just call them up and say, hey, listen, I was thinking about maybe buying lunch for you guys for your CNA staff or something. Heather had a great idea in the chat to build a snowman outside of a community for the seniors. I mean, you know, yes, we can't be on site, but there are things that we all can do to help somehow, some way. So definitely get out there and do that. Sherry, you're awesome, by the way. Thank you for all your knowledge and info. Thank you.
All right. That's it, everybody. Thanks so much. 9:59. Have a great week. Go kick some ass. All right.
Thanks,
everybody.
See you.
So long.